Pennine Care Criminal Justice Mental Health Team consists of 7 members who are currently strategically placed throughout the Trust footprint. Our role is to ensure that anybody who is currently involved with the criminal justice service or on the periphery of, that their mental health needs are addressed and risk managed effectively, ensuring that the public protection is paramount at all times. We as a mental health team are challenged daily by meeting the needs of our client group who may have a mental disorder and are clearly vulnerable. These are often the most marginalised group within society. The case of JB encompasses the work undertaken by the team and highlights the values of the Trust.
So how have you been since the last time I saw you? JB was initially referred to our service from the community mental health team. I became involved because there was an outstanding court case. He was currently an inpatient, so I met up with JB on the ward. During my initial couple of meetings, it became very apparent that his level of understanding wasn't as people had perceived. He was a male who had a significant history of self-harm, and he was very, very vulnerable in the community.
What do you think is going to happen?
He had a lack of trust in professionals because he'd had some really negative experiences. Over a period of time, I built up a therapeutic relationship with him, developed the trust and engaged with him really well. During this period, there were numerous appointments that I supported JB to. A lot of these were outside of my normal working hours, but it was apparent that he had significant needs in a lot of areas within his life. It was a very difficult case to work on because when I became involved, he'd already pleaded guilty to a case. JB had said from the word go that if he were to receive a custodial sentence, he would end his life. I worked with him to get the plea vacated. I was able to liaise with different agencies. I was involved with the probation service in making recommendations for a pre-sentence report. I worked closely with the barrister and the solicitor. JB received a community sentence rather than a custodial sentence. He was rehoused in supported accommodation. He's engaged with support services. He hasn't reoffended, and that's been a really positive outcome for him and the service.